from breakthrough strategies to game-changing innovations and cultural shifts. You'll discover the lessons that drive real impact, and we'll dive into the moments that changed everything. Welcome to The Missing Piece with April Reed. From repairing failing hearts in the operating room to navigating life-threatening emergencies in the air, Dr. Matthew Cooper has spent decades proving that leadership thrives under pressure. Today, he serves as principal and CEO of Peak Aerospace Medicine and Cardiovascular Surgery, bringing together a rare blend of surgical expertise, aerospace medicine, and executive leadership. Trained at Columbia University and Great Ormond Street Hospital, and with experience as a chief medical officer with a Fortune 100 company, Dr. Cooper has operated at the highest levels of healthcare. He has also spent 25 years as a senior aviation medical examiner with the Federal Aviation Administration, shaping conversations around safety and risk in aviation. Dr. Cooper doesn't understand complex systems, he redesigns them. It's a privilege to have you today with us. Thank you for joining us.
April, it's my pleasure to be here.
I feel so honored to be able to interview you and feature your story and find out more about you. It's fascinating and exciting. I know we're going to have an incredible conversation. I love to have you take us back to the beginning. Take us back to when you were young. How did your journey even get started? Where do you come from? Take us back to the beginning and introduce yourself.
Well, it started very, very pointedly and poignantly with the loss of a 6-year-old brother. He died of acute leukemia, an acute leukemia that's now universally treatable. And so very early felt that loss, saw what it did to my parents, and saw how my parents responded and treated my remaining brother and me, to love us even more, to make sure that we knew that they were behind us. And among the things they told us consistently is, we'll support whatever you want to do. We suggest, however, that you choose something that has some degree of self-determination, but we'll support you whatever.
Wow. And how old were you at the time when you lost your brother?
So I was 8, my youngest brother was 4, and my middle brother was 6.
Okay. Wow. You know, it's interesting when you have even defining moments as not only when you're that young, but then with your family defining your moment. So, all right. So fast forward a little bit, you have the support of your parents. They want to see you be determined. What led you into medicine?
Well, I think it's true in all walks of life that personalities self-select in terms of choice of careers. And I think early on, my constitution was built much like my father's, with strength and fortitude and broad shoulders and the sense of being able to bear where the buck stopped. And that really transformed and set the stage and foundation for being able to make life and death decisions and wanting to be in the position to be able to do that and to help people do that.
Wow. So you go to medical school. And did you know what you wanted to practice at the time, or did you just decide you want to save lives? Why not practice medicine? That's what you do, I guess.
Well, it started, the focus on the heart started before that. When I was an undergraduate, I was a double major in mathematics and biology. And as a senior, I had an opportunity to do independent study, and I did mathematical modeling of the heart. And so I already had an interest in the heart. When I was first and second year medical student at New York University, the chief of surgery was a very famous cardiac surgeon. He ultimately operated on both my parents during that period. And so I got to know him. And at that point said, you know, if you're interested, boy, why don't you come work in my lab? And that was the start of it.
Wow. That's actually really inspiring and encouraging, because my children are mathies, and you wonder, like, where does that lead you? So who knew you're a mathie and yet you become a cardiac surgeon? So take us on that journey to deciding to become a cardiac surgeon.
Well, again, it's back to that, where does one's sense of self see themselves? And again, I was always responsible, always to be modest, courageous, and sometimes bold and somewhat fearless. And I think that's among the qualities you need to be able to make the decisions about patients who are in extremis. Doesn't mean we cure them all, and it doesn't mean we help them all, but to be willing to take on that challenge takes a large sense of self to be able to do that, because we don't always win. And the ability to get back up again to learn from what we experienced and then to help that and be better for the next patient is part of what
Wow.
makes a cardiac surgeon.
You think you're in the business of saving lives, but what you just said that kind of resonated is, can you be resilient enough when maybe that doesn't happen, and how to still get up and have that determination and keep facing the day, and how powerful that is.
Well, it's a practice of medicine in a very real sense for surgeons
Mm.
because despite all of our study and training and our absolute commitment to do our best, we're human. We make
Mm,
mistakes, we miss things. Patients don't all respond in the same way to our interventions.
of
And
course.
so sometimes things happen. Sometimes we as surgeons, but also the team in particular, work together to notice when things are misdirected and so we can rescue and result
Right.
in a great conclusion.
Wow. So how long were you practicing as a cardiac surgeon before you start shifting career?
Right. So I was practicing almost 25 years, and I was
Wow.
doing adult and pediatric cardiac, and I had additional training in congenital heart disease and also doing transplants.
Unbelievable. All right. So at some point you decided to step away from surgery and try something completely different, which is unbelievable. What was that? And what was it that just that pivot in that moment to say, I'm going to maybe try something different?
Well, so it was a long time coming in some sense, and I think a lot
Okay.
of people will tell you again, not all originating medicine, that when you've done the same thing over and over again, maybe the 10,000 times to qualify as an expert, it's a little bit of a game of pattern recognition, and so it takes you a couple of milliseconds to recognize the pattern, and then the algorithm of what follows is defined. And so, getting a little intellectually bored. I was also looking to increase my impact from just 1v1, one patient at a time, to a more global impact.
Okay. So what did you do?
So I had picked up an MBA along the way with an emphasis on design innovation, applied to everything from product to processes. I remained intellectually curious. I was living in the Twin Cities, Minnesota area and looking for a job where I'd have a broader impact, put that together. Healthcare had a position for an MD MBA, which seemed to be a good entree into something different with a broad impact. And so I joined 3M. Ultimately, was there about 10 years, but my first job was to help lead the development of their artificial intelligence across medical specialties with a global impact.
Amazing. And this wasn't your background. So it must
Well,
have been a
well,
world of, uh-huh,
Well, I had mathematics. I
right.
had significant computer science training along the way as well,
Okay.
and including some programming, although not an expert programmer and certainly not in the languages they're using nowadays. I grew up on BASIC and Fortran 4, but they've advanced somewhat. But certainly the conditioned mind, if you will, the discipline
Mm.
to be able to learn and then apply was what was being used.
So a couple of things that you've said as far as like pattern recognition, even going back as a little child, it's intriguing me because are you saying that basically we're cut from a cloth that we're drawn to? For you, it was math and science and determination and will and learning. Do you feel that when we recognize the patterns inside of ourselves, it basically helps move the needle forward in our career and where we should be going? Because like you said, it was like, oh, it was kind of as designed. You step away from surgery, you come over, now you're at the forefront of AI, and you're like, well, of course. Like to me, I'm like, that doesn't make any sense. But to you, you're like, no, it made perfect sense. Do you feel like that happens a lot with careers and journey? What's your thoughts?
So I think it's a combination of things. It's a combination of what you've created of yourself internally, but also what
Mm,
your circumstance of either employment or outlets for expression allow you. And sometimes that circumstance doesn't allow you the creativity or the full expression of who you think you can be. And so that's why sometimes a different context, a different circumstance that allows you to be more than you are in your current. And I think you've probably met people who've changed careers, and very often they're happiest in their most recent career. Because as we age, our interests change, our passions change. They
mm.
evolve. Our own capabilities, our own cognitive, intellectual, and creative capabilities mature in some ways. And so the outlets for that may need to change to allow that expression.
Oh, I love this. I love that. I mean, you're really speaking to even that like I mean, myself, that middle-aged market, and really kind of tapping into that, saying, maybe even though I've done this for the last 25 years, what's next? So you come over to 3M, you get involved with their artificial intelligence. Take us, over those next 2 years, kind of your history and evolution, and also introducing the aviation side of you.
Sure. So I was there for 3 years and then moved over more centrally to 3M. Ultimately became Vice President Medical Affairs and Chief Medical Officer across all of their healthcare offerings. And so it was much broader now, not just the artificial intelligence, but also everything from preoperative and perioperative medical products to things like the Littman stethoscope that I grew up with medically
Mm.
and helping to design the future of that. And so it became much more broadly involved in evaluation of technology, medical device innovation, but also a sense of, okay, what does patient safety look like? And I had and developed in parallel a significant aviation career. And one of those was an orientation to patient safety or pilot safety. And when I joined 3M, patient safety was really much more defined at a corporate level as parts per million or Six Sigma. And so I
Mm.
introduced, in partnership with our quality colleagues, philosophically and operationally, a sense of patient safety that was built on an aviation model. And that model was, how do you convert the whole involvement of a manufacturing process with a patient at the end to a higher reliability system? So it becomes looking at manufacturing trends that have the potential to harm people, low acuity clusters events, high acuity sentinel events, or the possibility of misuse of a product. And so it really turned around. And I think I may have mentioned to you previously that as human beings, one of the things we all do when we get a new product is we open the package, then we throw away the instructions for use. And so for a medical product, how do you how do you turn around and design into that product the
Yeah.
tolerance of variability of use so that the product's still safe, but it's also going to do what it's intended? And so that
Yeah.
became a significant part of what I did operationally and leading that philosophically at a rather large company. But that was initially all based on my sense of prospective system design from an
Yeah.
aviation world.
Today, you serve as the principal and CEO of Peak Aerospace Medicine and Cardiovascular Surgery. Introduce us to that. What is that? What do you do in your day to day, and what is Peak Aerospace Medicine?
So I do everything from consulting to several medical device startup companies, some of which are medical device, some of which are the latest, greatest cutting edge of artificial intelligence applied to
Wow.
medicine, to consulting to the Federal Air Surgeon and at times the National Transportation Safety Board in terms of certification and medical standards of safety for the system, but also helping to rewrite policy for the aerospace, medical, and transportation system. In addition, I see individual pilots. I see most of the congenital heart disease and complex cardiac disease of individuals who interface with the FAA and want to fly. And now that we have adults with congenital heart disease that are growing to adulthood, they want to do everything everybody else does. And so there are special considerations when you take somebody with an abnormal baseline physiology, possibly, and put them in an austere condition like flight or potentially even space.
You're like fascinating. I just want to get in your brain and learn it all. It's exciting though, because you're always been at the forefront, or it sounds like the cutting edge of everything that's happening. It's really remarkable. So in all of like the success you've had and all the different roles you've had, can you think of a moment in your career that maybe something went wrong? Maybe it was a decision, an assumption, a belief. What is something that you had to unlearn? It's so easy to like, oh, this is, we all get right. But is there something that comes to mind?
Well, there are lots of things. You live a life, and as a human being, some of the things that I've gotten right and wrong were how I judged people. I've
Mm.
always sort of approached individuals, new individuals, looking for the best in them in terms of their character and motives and motivations. And sometimes you get disappointed when you learn about them. On the other hand, sometimes I've prematurely judged
Mm.
people who I found to be really dialed into the right things, the right intentions, the right motives, who became lifelong
Mm.
friends. In terms of decisions I've made, there've been decisions I've made as a surgeon. You know, individuals don't often respond to the same things we do in the operating room on a daily basis, and so I've had patients die despite my best efforts, and so those were a result of my decisions. All surgeons have had that experience. Cardiac surgeons, neurosurgeons to a greater degree, perhaps. And so you learn from that. And as I mentioned earlier, you learn, you never forget, but you make use of that to make you better for the next patient.
I can't imagine, that resilience that you've built, and it's remarkable, and it's actually inspiring, to be honest. Well, with that heavy comment, I have a fun comment. When you're at a dinner table and people look to you and they say, "Well, Dr. Cooper, what do you do?" What is your response? What do you say you do?
So I've not served in the military, but I think about it the way the Marines say, once a Marine, always a Marine. So I
Yeah,
say I am and will always be a cardiac surgeon because that's my foundation, my training, my
yeah.
experience, and my corporate medical experience is built on that. And if that person is still interested and still around, then I'll tell them about the aviation side.
I love it. That's awesome. And the aerospace side, and the federal side, and consulting side. That definitely makes sense. So you've obviously been around healthcare for a long time. The evolution of healthcare and technology, from electronic health records to now advising healthcare and medical device startups, which is really exciting and interesting. I would love to hear your opinion on where healthcare has gotten it right, and then where you also see room for improvement for the future.
Well, so I think the biggest challenge for healthcare, and it's manifest to everybody who's engaged in the system anytime recently, is that it has to start and end with the patient and patients' enhanced
Yeah.
outcomes. And if we're able to improve the outcomes, then the economics usually follow. Not directly sometimes, but that's the case. And so you have to maintain that orientation. Sometimes corporations get a little bit askew about that. The other thing that everybody sees is that care is more and more very, very much fragmented. And there seems to be a loss of the one person who's got full situational awareness of everything going on with a patient and coordinate it. And individual providers, they get very busy. The system's not always conducive to the best care. They get complacent. Sometimes they get lazy. When that happens, when you push people or compartmentalize their time too much, they get complacent, lazy, and they accept average care. They don't push the bounds to get the best for patients. And I think that has to change. I think that's the main challenge of current medicine and future medicine. It's not just access issues, which are real and inequitable, but the foundation of how we practice medicine, of what we deem as adequate, what we accept without daily improvement, has to change fundamentally.
Yeah. Yeah. Even when you just said from the aspect of getting lazy, I think that resonates in general, in whatever role, in whatever it's, when you become complacent, you forget your mission, you forget your purpose, you forget your why. And you just drift and you just cruise control. And that's a really powerful thought in even self realization. If you feel like you're a little checked out or a little complacent or a little lazy, it's like maybe time to reevaluate.
Yeah, it's both an individual issue and a systemic issue
Corporate.
because it's very difficult for an individual, even the most dedicated individual, the
Mm,
most tireless individual, to daily and every minute fight the system. So the system
mhm.
has to evolve, and we look to great examples because there are great examples like the Blue Angels or the Thunderbirds. Where they develop a culture of continuous improvement at the highest
Yeah.
level of performance doesn't mean that they're not critical of every detail
Yeah.
because the culture has the maturity, because they've got a sense of a shared experience, a sense of being part of something bigger than self. And that's
Mm,
how you get to that pixie dust level of performance. But that's what in healthcare patients expect of us, reasonably so.
yes.
And so
Yes.
that's one of the things I think that healthcare has been better and worse about is how do we learn from other systems or other pursuits or other enterprises? And how do we
Mhm.
learn new models? How do we continue to reevaluate our processes and our
Yeah.
structure so that we can get better?
I love that. I love that. I think we have a lot of C-suite that listen to this podcast, and I think it's a good challenge, for not only themselves but for their team and the way the hospitals are leading. Really, there's a lot of wisdom in that. Um,
If I might just throw out one more point, and part of it is that, and I'm, as I think I'm a bit of a disciple, actually a big disciple of John Boyd, But the concept of agility, his concept of agility, is a bit different, and that is that the processes that got you here may no longer be sufficient for the present or for the future. So you've
Mm.
got to keep looking to grow either organically or inorganically.
I'm sitting with that for a second as the CEO of my company. That's sitting with me
Mhm.
where it's like, hmm,
I think
okay.
Jack Welch said years ago, it's easier to steal an idea than come up with an idea or something to that effect. But I think the idea that you continue to look outside your culture as well to learn, because you don't have to come up with the solutions, particularly if those solutions may already exist very effectively.
When's your book coming out?
So I have
Oh, you
chapters.
are.
I have
I
chapters.
was joking.
Well, my own personal book is still in. I am writing one, but it's early. But I do have chapters coming out in the first two textbooks about surgery in space in June and July this year.
That's incredible. I meant your own personal book, but yes, let's talk about it. Surgery in space. That's unbelievable. Which goes to my next question to a certain extent is the future of healthcare and technology. Your perspective on it, your thoughts.
Well,
Surgery in space is pretty awesome. The fact that you're writing on that.
right. Well, I think that people would be surprised to know that artificial intelligence has been involved in decisions about their care for many, many years. And I think that's nothing new. I think it's getting a lot of publicity, but I think it's also important to see where the current development of artificial intelligence is. And recent studies coming out of Harvard and MIT have looked at this as a field and suggested that the current maturity is such that it's not yet at a level of substantive human creativity or innovation. And so it means that artificial intelligence as it is can very well replace the repetitive and even relatively simple pattern recognition that we all do in our tasks. And that frees us up to do the things that we're inherently good at, which is the creativity and the innovation. It's also
Wow.
true that there are a lot of cautionary tales about AI, and some of those have been written about and such, and that while it has great potential as a great tool, it's also quite clear that what you get out of various AI programs is based on bias, in some cases, bias in the programming. And that programming could be biased in terms of social, political, economic, or other ways. And so you have to be very cautious about how you evaluate the output. Is it biased output? Is it a function of the programming? Is it objectively validated, or is it fictional based on the programming? The other thing is with artificial intelligence, we have no idea what the reward structure of some of these advanced systems are. And so while it may be a great tool, it could also be a weapon in a sense. And so
Mm.
there is reason to be both tremendously optimistic about not
Mm.
replacing humans, but augmenting our cognition, augmenting our creativity. But there's also great caution and necessary preparation and design to make sure it's not used incorrectly.
Yeah, 100%. When someone asks you personally to come in and be an advisor to them, the medical devices, or sit on the board, or you have a way that, kind of go filter through if you're going to accept that invitation, I imagine you probably only say yes to a few.
Right. Well, I'm honest with myself. I'm honest with them. And first of all, is an area that I think that I can help take them beyond where they are. Is it an area that interests me? Is an area that I have some deep-seated passion about, hopefully. And then the circumstance of the engagement obviously is the final. But those are the sort of general filters. I also look at the reality of whether this is something that can be brought to market commercialization. There are a lot of
Mm.
inventions that are not truly innovations, and there are a lot of innovations that can never be commercialized for one reason or the other, or the timing's not right. And so
Yeah.
all of those things have a role in decision making and my own decision making about whether to actually engage or not. And I think those are
Mm.
decisions that startups need to make early and big companies need to make. Sometimes the hardest decision is what not to do.
It's true. And sitting with that and taking time to evaluate it.
So the first thing I do, and one of the skills I've gotten better at, hopefully, as I've gotten older, is I listen more. And up front, you need to listen. You really need to be humble and open yourself up to learning first so you can get an assessment of where they are and where they want to go.
That's really good. That's really good. If you were to go back to your younger self, thank you for sharing that family story. It's really kind of set the tone. If you were to go back to that younger self, maybe before you knew where you were today, what would you say to your younger self? What would that advice be?
I would say, well, you got some things right and some others you could do a little bit better. I would say it's okay to continue to question at times and at times be bold. It's also important to take the time sometimes to socialize and build alliances for more impactful achievement. Sometimes you can't do it or you can't ideally do it by yourself. And it's also sometimes wiser to be more patient. Unfortunately, sometimes not to be trite, but it's a marathon rather than a sprint, and you have to take that time. But it is important. And one of the things I would tell myself to do more of, it is okay. And it's important for not just you, but for the bigger potential of humankind to be willing to take the path less trodden. I mean, it's easy to fall into standardized patterns of education or training or employment, but we as a society benefit when people break that mold to be more than just that.
I love that. I have no doubt that your legacy is going to be known forever and you're still just getting started. What's next for you? I mean, just continually in the past that, obviously you said you're going to write a personal book, which you need to do, but do you still have more ambitious dreams inside of you?
I'm not done. I mean, I have a daughter who's in college, but I'm not done. I think my intellectual curiosity, hopefully my energy won't fade anytime soon. So I think big impact, disruptive impact. We're barely functioning at our current state. If you look around the world, not just individual pursuits and ventures, we're doing okay, but we're not necessarily conquering all of those. And so if that's the present, what does the future look like? How do we get individuals or enterprises, our societies ready to conquer the future? One of the things in particular I mentioned earlier, one of the things that I'm particularly interested in is how do you take people with abnormal physiology and make it safe for them to successfully fly and work in space? Our current space station is nearing end of life. There are several commercial entities that are going to replace it. It's predicted that by the next 20 years or so, we'll have thousands of people working in space. We already have manufacturing in space. We have a potential launch of future planetary exploration coming from full-time bases in space. Well, how do we make it right for the people to be able to do that? How do we protect them? And then that's where the artificial intelligence comes in, because terrestrial-based testing doesn't give us an accurate sense all the time of how people perform in those extreme environments. And so if we can't do the testing, how do we build that into system monitoring and go further and say, okay, well, if the system perceives a monitor, perceives a need for information in some way or some rescue in some way, how does the system then do that? And so it becomes a real partnership of technology and the human condition to optimize both.
You're unbelievable. It's exciting. It's amazing. It's surreal, and that the time is now. And I agree. We're just scratching the surface. We really are. Even if you look at, like I said, I've been in healthcare IT since 2004. So I'm 22 years in and it's still just beginning. Every day you see it improve a little bit more, but it's unbelievable where we'll be. And you are a part of that future in ways I've never heard before. So it's fascinating.
Well, but I think you and I both, and we're in this with a journey with a much bigger group, right? But I think part of the common issues that are going on right now, one of the things that we experienced with Apollo and the first moon landing was an ability to prioritize and organize and put global effort behind a single mission. And I think things have become very fragmented, not just in healthcare, but in other things. And in order to achieve generational progress again, we've got to be able to prioritize and organize resources appropriately. And I think we're not so good at that right now. And I think we've got to develop trust in our systems, trust in our governments, trust in our leadership to enable resources to align for us to achieve great things. We talk about curing cancer, we talk about curing organic brain disease, we talk about getting to Mars, all those things. They require tremendous organization of resources and focus of resources that requires critical prioritization. but it starts with trust.
That's really good. Really good. That's incredible. If people would like to get in touch with you, should they just reach out on LinkedIn? I'll leave your contact information. Is that the best way?
Sure, LinkedIn is fine. I'm happy to share my email address, which is mmcoopermd@gmail. I think that's pretty easy to find. I do respond.
Oh, that's amazing. Well, we'll make sure that that's included as well. Any final words? I mean, I'm going to listen back to this multiple times. I feel like I just got mentored by one of the greatest minds. Any last remarks?
No, I think that for all of us, the best thing is to never sell ourselves short, is to keep being curious, keep being open to learn and to grow. And I think we're all better for that on multiple levels.
One of my themes here at my company is ABL, which means always be learning.
Mhm.
ABL, and I challenge them all the time. We have to always be learning. Thank you for your time, Dr. Cooper. It's been an honor. Thank you for your insights and your wisdom and for carving out this time to be here. I really appreciate it.
My pleasure, April. I look forward to further conversations.
Every leader has a story, and every story reveals another piece of the bigger picture. What if the missing piece wasn't something you had to find, but something you were meant to become? Subscribe, share, and keep leading with intention. I'm April Reed, and I'll see you in the next conversation on The Missing Piece.